health services, waste management, hygiene in food chains, and water and sanitation. Putting people at the centre of urban and transport planning, responding to the needs of all citizens. Promoting connectivity in diverse neighbourhoods and improving the quality and safety of public spaces to favour mental health, physical activity and social cohesion. Improving road safety and managing traffic to reduce injuries and casualties. Protecting common goods such as soil, water, air and the natural environment in an integrated way across sectors. The Sustainable Development Agenda, including SDG 3, is about ensuring healthy living, fostering well-being for all people at all ages, and promoting indicators to monitor progress. This can only be achieved through local action.
Yes, good afternoon, good morning, and good evening, everyone on this call right now. It's such a beautiful day, and I hope it's the same at your end. Please, I like someone to confirm if they can hear me loud and clear.
Yes, we can hear you, sir.
Oh, fantastic, fantastic. So you're welcome to yet another edition of our Sustainable Development Goals Roundtable series, especially that of the month of May, which is focused on SDGs 3, which is all about um, good health and wellness. We've had this roundtable series for quite a number of months, starting from January this year. We've looked at different sustainable development goals depending on our choices for each and every month. And this month, we have thought it right to be looking at SDGs 3. For those of us that have always been a part of the Roundtable series, you remember we had a great time looking at no poverty. We had another fantastic time while we looked at life on land and several other sustainable development goals, which are 17 in total. And just this afternoon, our focus area which will be on building resilient health systems for Africa's development, has been coined and is resting on the Sustainable Development Goal 3, which is on good health and well-being. And for us to start this session this afternoon, I'd like to hand over to Mr. Abioye Oluwafemi to welcome each and every one of us to this call this afternoon.
All right. Good afternoon, good morning, good evening, according to your time zone. You're welcome to today's edition of SDG Roundtable series. It's always an interesting time for us to learn, for us to equip ourselves with the SDG, with every necessary information we need to gather so as to ensure that these goals are fulfilled in line with United Nations. So it's another wonderful time. Just like what Mr. Mayowa said, so much concern about our health this week. That is our focus. So this afternoon, we'll be looking at issues around our health. We all know that health is very important. It's the aspect of our life that we cannot trivialize. We cannot just throw or handle anyhow. Health is an aspect whereby it determines every other aspect of our life. It's only someone that is in good health that can actually do the needful that ought to be done on a daily basis. So I welcome everybody to today's edition. And of course, our facilitators are right there on ground. They are ready to give us every knowledge that we are in need of. They are equipped, and I believe that at the end of today's section, we will definitely be a better person than we are we came. So sit down, be ready to learn. And on behalf of ADF Africa, on behalf of the entire team members, on behalf of our facilitators, we welcome everybody to today's series. Thank you.
Yes, yes, thank you very much, Mr. Femi. And of course, we are glad that we're having every other person on the call this afternoon join us. And I also would like to say a kind welcome to our guest speakers who, out of their busy schedule, have just created time to join us on this program this afternoon. And that is, you know, great fun and fantastic persons that we have on this call this afternoon. Before I will introduce them, before I will introduce our guests to you, I felt like since we have people who have always been a part of this program since January on the call, I was thinking that readily by now I would see some actions going on in the chat. Of course, I would like to acknowledge, I think I saw, yes, Susan, saying she's excited to be here today, of course. And I'm sure that Susan will be having a great expectation for this roundtable series this afternoon. But I also would like to hear from a few of us who might want to also just say one or two things, say hello to us, and tell us where you're joining us from and what your expectations are from this roundtable series this afternoon. So, is there anybody that wants to, you know, say something before we go into the section? Okay. That's fine. That's fine. So yes, we would just go right into it now. This section this afternoon will be in two ways. We have a presentation from one of our speakers, and after the presentation, we'll be having a question and answer, and we'll also be having that part where we have our participants, contribute to the discussion that is ongoing here this afternoon. However, I also would like to say hello and a good day to every of our participants that are live on the YouTube who are streaming this section live. Of course, you know how it has always been, and it's really going to be a fantastic one again. So, introducing our guests to us this afternoon, I have the pleasure of introducing to you Dr. Maurice Atoki. That is Honorable Dr. Maurice Atoki, who is the CEO of ABC Health. And yes, before I go on to read the profile of Dr. Morris, I just want her to open her camera and just say hello to the audience. So then thereafter, I would read through a profile.
Hello, everyone.
Oh, fantastic. Good afternoon, madam. All right. So, Dr. Morris is a seasoned business strategist and development expert with a strong academic background, including degrees from Harvard Business School and the London School of Business and Finance. She currently serves as the CEO of ABC Earth, a social equity organization focused on improving health outcomes across Africa. Additionally, she leads the Health Policy Commission of the Nigerian Economic Summit Group, promoting public-private sector collaboration on health issues. She has over 12 years of experience at top firms like PwC and EY. Dr. Atoki has led numerous projects and initiatives and serves on several boards, yeah, including Mobi Health Digital, Transnational, and Zenith Health. I think this is quite a profile that we want to give our virtual reactions to. And, with a clap, I think I want us to acknowledge the presence of Dr. Morris. And before I hand over to Dr. Morris for our presentation, I also like to welcome our second guest speaker, that's Dr. Olaide Omotosho Ikuru, who is also a medical practitioner. So, Dr. Olaide Omotosho, if you would just unmute your mic and open your camera, let our audience see you, and I'll go on to read your profile, ma. Oh, great, great.
Good
Good
afternoon.
afternoon.
Good to be here. Thank
Yeah,
you.
fantastic afternoon. Wow, I love your background, ma. You're still at work. That's great. Of course. So, Dr. Olaide Omotosho Ikuru is a medical practitioner, a preventive health specialist with over 2 decades of medical practice. She is the medical director of Earth Kynet Clinic, Lekki, where she runs an outpatient clinic with a mission to discover, and defeat diseases. I love that. Such a great vision. And her primary focus is on women's health. And this she teaches through health education, screening, and treatment of early signs of the two deadliest but highly preventable diseases, breast and cervical cancers. These diseases are highly preventable and the early stages are highly testable. She is proactive in medical mission, a prolific writer, a public speaker, and a counselor. She is happily married with children. I hope you are doing welcomes to our two great guest speakers this afternoon on the chat or with your reactions live on the YouTube channel. So, on behalf of the leadership of ADEF Africa, I'd like to once again respectfully welcome Dr. Morris and Dr. Olaide to our roundtable series for this month of May. We are glad that you're able to make it to go with us on this session this afternoon, and we do not take all of your commitments for granted. So, as we progress now, I want to hand over to Dr. Morris for a presentation. We'll be taking about some 10-15 minutes presentation from Dr. Morris, after which we will then go into the question and answers, which Dr. Olaide would be helping us to manage. So please sit back, ladies and gentlemen, as we are going now to enjoy quite a fantastic presentation. So, Dr. Morris, this is the time that I hand over to you, ma.
All right, thank you so very much. I'm going to try to share my screen. And good afternoon, distinguished ladies and gentlemen. Good afternoon, Dr. Laide. And thank you all for having me. So the topic that I have today, I hope you can see my slides.
Yes, we can see the slides.
Okay, so I'm just going to try to put it on slideshow so it's more legible.
Yeah.
So the topic we have today is building resilient health systems for Africa's development. And within the course of preparing for this session, I had, in my mind, just wrapping around what is the best message to send across to the audience, to the participants for today. Again, just like the topic says, it's about, building strong institutions, resilient health systems for the development of health at a continental level in the Africa that we're in. And in introducing it, it's just really imperative to talk a bit about the infrastructure of health in Nigeria as a case study. We all know that it's not as developed as it should be. It lacks, the basic modern medical facilities. The indicators are that some of the worst, where we have some of the worst in Africa. In terms of mortality, we rank very behind as a low and middle income country. And coincidentally, we're one of the fastest growing populations on a global level. We have about 5.5 live births per woman and a population growth rate of 3.2% annually. There's also report estimated that we will reach 400 million people by 2050, and that makes us the world's third most populous country. Unfortunately, we don't have sufficient medical professionals that are attending to the needs of the healthcare in Nigeria. We have an estimated 35,000 doctors, despite the needs of 237,000 that we can assess, and this is according to the World Health Organization. Well, in recent times, it's been said that especially due to the massive migration of healthcare workers overseas, we lose about $2 billion every year on medical tourism. And according to NMA, India accounts for more than half of this outflow. Again, you will know in some of these more advanced environments, India seems to be one of the cheapest locations where we get more advanced medical health care for Nigerians and for a lot of Africans. But more importantly, I wanted us to, and that's a bit of background. I wanted us to remember that this platform again talks or kind of leverages the United Nations Sustainable Development Goals, particularly Goal 3, targeted at good health and well-being. And I wanted us to kind of reflect on the why. So over time, over and across many nations, development just has been really, really epileptic. So some nations will develop at a fast pace, some will not develop at all, some will develop very slowly for some time and then pick up, and so on and so forth. So at a United Nations level, it became imperative to help engineer and to help kind of direct, development at national levels. And so United Nations invited governments of nations to participate in responding via something called the National Voluntary Review at a high political forum of the Sustainable Development Goals. So what that means is that when you sign on, by the way, Nigeria is one of the signatories, on an annual basis, or when you are ready, maybe on a biannual basis, you bring the report of your progress as far as the achievement of the Sustainable Development Goals are concerned, and you report. Now I'm going somewhere because I also wanted us not to lose sight that this topic is anchored on that Sustainable Development Goal 3. And what exactly is Goal 3 saying to us? As you know, the goals will have indicators by which United Nations will measure, or whoever is assessing progress will measure, the achievement of the goals. And of course, targets. Targets also means where you are going. And I wanted us to just, reflect on a few of those goals so that it re-echoes in our mind and we bring it to life. What exactly do we mean when we say we have targets, we have indicators, and we're trying to achieve the goals, particularly Goal 3 in this case? The very first goal is anchored on maternal mortality. And again, you must understand that the wordings of these goals, the rankings of these goals are deliberate. Again, if you consider this goal 3.1, is so that it is no longer permissible, it's no longer tolerable to consider the rate at which we're experiencing maternal mortality. And if you care to know, Nigeria is ranking the worst all over the world in terms of how severe the mortality of mothers are during childbirth, particularly. And so the goal is that in another 6 years, by 2030, there must be a reduction at a global maternal mortality ratio to less than 70 per 100,000 live births. Now, if I were you, the question I would typically want to ask, if I was really interested in what I claim, I'm interested in the knowledge of these goals, and particularly goal 3, I will want to know where we are at as a nation, as Nigeria, because this is a global goal. It talks to every country that has signed on. So my question would be, if the target, if the goal is that in another 6 years, there has to be reduction per ratio of less than 70. So we're saying that there must be less than 70 deaths of 100,000 women who give birth and their children are alive. And so those are questions, those are curiosities that you should have if you want to, have a lot of knowledge about the goals. I won't go to the other goals. I just wanted to lay the foundation of how your mind should wrap around the interpretation of these goals and what it means. Of course, there's neonatal and child mortality as well, with its own targets. There are infectious diseases, non-communicable diseases, substance abuse, and so on and so forth. Now, as we go on, we're talking about the challenges. So you remember the topic is about resilience in our health systems at an African level. So some of the challenges that we have discovered is that, just a minute, is that Africa lacks the capacity. The challenges are so multidimensional and they are interconnected. Africa lacks the capacity to respond effectively and efficiently to its evolving healthcare needs, majorly as a matter of its fast-growing population. And overcoming these obstacles is important for us to begin to even attempt to build strong institutions and resilient health systems. Of course, there are issues around infrastructure, there are issues around limited access, there's resource scarcity, and so on and so forth. And so when we talk about the resilience of a health system, what are the critical components? We talk about hospitals, the role of hospitals and clinics, the human resources, the personnel that will provide that healthcare, and of course, how are we also advancing towards technology? In terms of accessibility, and this is a key component, again, think about universal health coverage. Accessibility is a key component and it plays a crucial role in ensuring this resilience that we talk about, in ensuring inclusivity, in ensuring coverage, and in ensuring equitable access to healthcare service. So when we talk about accessibility, don't think about those of us in the suburbs or in the semi-urban environments. Think about those in the villages. Think about those in places where you don't even have academic institutions. How do they access healthcare? The coincidence for a place like Nigeria is that they are the majority. So again, when we're looking at fancy Lagos or fancy Port Harcourt or fancy Ogun State and Abuja, and we're seeing infrastructure, we're seeing good roads, we're seeing buildings. That is not the representation of Nigeria. The bigger demographics, the bigger geographic locations of Nigeria is way, way under developed. And we need to have that understanding, somewhere in our minds. And so when we talk about accessibility, it's important for us to think about mobile clinics, outreach programs, implementation of community care initiatives, how to reach the unreachable, maybe through telemedicine solutions, and so on and so forth. Again, in talking about resilient health systems, you must consider disease management. And if you're considering disease management, you think about education, you think about prevention programs, treatment services, epidemic preparedness. And we know without being told that all of this generally are not priority in very extremely poor localities. And so these are things we need to have at the back of our mind, that for a Nigeria or for countries in Africa to evolve into that level of building a resilient health system, there has to be equality, there has to be accessibility, and diseases needs to be managed. So there has to be health education provision to a very large extent. We have to establish proactive prevention strategies. You need to ensure quality treatment services, and so on and so forth. Public health initiatives is also a major component. It plays a very important role to promote and enhance community health and well-being. Again, as you know, all over the world, vaccinations are beginning to gain more ground, unlike before COVID-19. But immediately they could, within a space of about 9 months or a few months afterwards, develop a vaccine for COVID. The world started getting more attention in that space, understanding that with a bit more focus, with a bit more deliberateness, vaccination actually can be more effective and can be more useful across population health. So there's vaccination campaigns, health education efforts, disease surveillance activities, and so on and so forth. Of course, capacity building is crucial. Again, we heard earlier that one of the things we're suffering the most is the fact that we're losing a lot of doctors to more developed environment. Again, we're being left with less trained health personnel or health professionals. Capacity building through training programs, skill development, and continuous learning. I think continuous is the critical matter here, and ensuring that it's benchmarked against global best health practices. To nurture a skilled and adaptable healthcare workforce is becoming more and more essential at a country and at a continent level. We must invest in ongoing education and development of healthcare professionals, health systems that can enhance capacity to address emerging health needs and provide quality care to diverse populations. So across critical components, hospitals, clinics, skilled health personnel, the roles of those hospitals and the clinics, the human resources, how trained they are, how motivated they are, how at par are they with advancement in medicine. And this cuts across the entire value chain of health and healthcare. And of course, how aligned are they with technology advancement? What are the funding strategies to think about? We think about government investment, international aid, and public-private partnerships. And very recently, there's also the thoughts around private capital. So there hasn't been a lot of leadway in determining how private capital will completely support health initiatives and improve health on a continental level, but it's gearing more and more attention. Again, because we've seen the private sector succeed at other sectors like the financial services sector. And they're beginning to be probing around why can't they translate some of the successes to health. But if you think about the prevalent funding strategies to health, you begin to even understand why we have issues in the first place. So government is not prioritizing health across the continent. International aid, it's only take a COVID to happen for you to know that countries that are aided will become non-priority if countries aiding have also issues to address. And public-private partnership seems to be one of the solutions, one of the ones that we need to invest more in, we need to understudy and promote as much as possible. Again, we know that there isn't sound health infrastructure without the collaboration between those who really want it, which happens to be most of the private people, and those who are saddled with the primary responsibility of public health, which is the government. So again, that partnership needs to happen, no matter how uncomfortable or inconvenient it is, in order to be able to reach as many beneficiaries as possible. So again, we're talking about access. It is public-private partnerships that we see will deliver that access. Of course, there's technology integration in terms of how the world is evolving. Electronic health records only make records a bit more efficient. There's the prevalence of data analytics, telehealth solutions, and so on and so forth. And these are innovative mechanisms that we think that Africa needs to really critically consider to be able to deliver on universal health coverage. So affordability, accessibility, and quality healthcare really needs this technology integration for us to move the needle at all. Of course, community engagement is essential. There are instances where we see communities where solutions are taken to, investments are made, but demand is not there. So the community are not willing to even take the offering. They're not willing to benefit from your so-called sophisticated healthcare. They'd rather die. They'd rather be sick. Again, there are a lot of social nuances that are responsible for all of this. And so engaging the community it becomes vital to earn their trust, to promote inclusivity. Don't just assume that they are illiterates, they won't know any better. Let's just go give them the solution. That has not proven to work. We must embrace cultural sensitivity. We must encourage community participation and foster stakeholder involvement as much as possible. In conclusion, is to remind us that building sustainable health system is paramount for us to achieve goal 3 in promoting health and well-being, and in achieving lasting health outcomes, in advancing development goals and in enhancing future resilience. By prioritizing all of this and quality care, inclusive access, equality in terms of being able to access health and healthcare, and long-term sustainability, health systems can play a pivotal role in promoting health equity, in fostering socioeconomic development, and in safeguarding community well-being in the face of evolving health threats and global challenges. Future resilience, we must be prepared, more importantly, to adapt to unforeseen circumstances of health, to be able to manage crises as much as possible, and to address emerging health challenges that has not even yet surfaced. Climate-related risks are there. It's no longer hidden that the heat waves are becoming unbearable, and we don't know what biologically they are likely to actually cause to mankind. And global health crisis, ensuring continuity of care and well-being for all individuals. Thank you for having me.
Thank you very much, Dr. Morris. This has really been a quite mind-blowing presentation. While the presentation was ongoing, I started to think about the states that you've presented, the health system of not just Nigeria, but majority of the African countries to be. And it seems as though the way I felt, while you were making the presentation is the same way that many of the participants are feeling, because I think I can already see in the chat now that, Abubakar is saying, thank you for your wonderful presentation. And beyond that, I see that our YouTube audience also, they are already saying it's nice to be part of this section. Many of them are saying kind words, and it means that they've really gained a lot of insights on this section this afternoon. I see another person saying it is quite helpful, in helping us get a clearer picture of where we stand right about today. So I really want to appreciate you, Dr. Morris, for this beautiful presentation. Thank you very much for helping us to establish the status of the health system in Africa and the key challenges facing health system in Africa. Thank you very much, Ma. Yes, under this, I am quite sure that we have a lot of questions that our participants may want to ask. I understand that you have some other engagements to attend to, but would it be possible for you to take one or two questions?
Of course, please go ahead with the questions.
All right, thank you very much. So this is when I want to I see one hand already before now. Someone has been raising the hand. That I think that's Abubakar Mohammed. Abubakar Mohammed, if you have a question, this is where, oh, Coach Richard, you also have a question. Okay, let's take Coach Richard first, and after that we can take Mohammed if he's still very much on there. Yes, Coach Richard, you can ask your question now.
Can I?
Okay.
Yes, please go on.
Good afternoon, everyone. Okay.
My question is that we have been spending much of our time for this advocacy, especially at April. Wonderfully, we have been provided with some certification for our period. But what make me to be so doubtful about the program is that one shirt that they posted into the group that they wanted to use the shirt for those that participated in the advocacy, but though labor for us if we have been contributed towards that movement. Thank you so much. That's my question.
Moiwa, you might have to repeat that question. I really don't understand it.
Yes, I was thinking, I think maybe because of his network, even I could not really capture what the question is. Coach Richard, do you want to come again, please?
Okay. Good evening, everyone.
Okay, fantastic. I think we can hear you now.
Okay, good evening. Thank you, Dr. Morris, for such a wonderful insight. I think you have actually shed light on the reality of our health sector. And as an educator, I think that that education provides a platform for solving most of the problems we are facing in Nigeria. When we talk about orientation, reorientation, and campaigns or enlightenment, I don't know, are there groundwork, are there scaffolds that we enable those who can actually do the campaign? I think most of the doctors leaving the country think abroad. I'm not trying to sound biased, but they think abroad is a soft work. And I think it's a way of escape from the realities with the political and social realities we face in Nigeria. But if the medical sector has a social reworking like reorientation, cognitive restructuring, and people actually get to look at beyond the comfort and all of that, I think we can still build a resilient health sector. We still have our challenges. We need funding. We have government policy. But aside that, it's deteriorating because we have the manpower being drained. You know, this Japa syndrome and all of that. It wasn't as worse as it is currently because we had people who could still manage the dilapidating system. But it's obvious now that those who could manage the system are no longer there. And even the young ones leaving the medical school now don't have any interest in wanting to serve the medical field in this country. Everybody is preparing his child, his young graduates to school house. There is a way that we can synchronize our efforts through educational campaigns. And my question now is, are there platforms that, are self-sponsored, that you can bring I can bring my ideas, people like myself or my team can bring our ideas together and synergize our efforts and see how, while we work as educators, reorienting the masses, we're talking about campaigns and simple ways on how to avoid certain infections, certain diseases, how to, do self-care and all of that, then the government and other sectors can begin to work on the structural aspect. Are there physical structures on ground, departments that handle such collaborations? Thank you.
Right. So your question, you will know advocacy is typically a function of a belief and a drive. So if you're asking whether there are existing advocacy structures physically on ground, in terms of educating in health, the answer generally will be yes. Of course, there are different So the organization that I, for instance, lead, we are majorly focused on providing knowledge for advocating and also advisory, acting as advisors to the private sector community. And when I say private sector, not necessarily the private health sector, the business community, and gearing their interest around engaging and participating in health. So that again is largely missing. I think because of the natural complexity um, of health as an area of knowledge, a lot of people don't typically warm up towards wanting to be part of advancing health. And that has to stop because Africa as a continent cannot afford that. The primary healthcare providers, who are the government, are not living up to their responsibility. And that largely leads us to uh, other participants of the stakeholder ladder to rely on, such as the private sector, such as the international donor community. And that by itself has not been sharpened well enough. So for instance, typically, what we've observed is that when a medical doctor leaves academics, he lives with the mindset that he's coming to render a kind of, help, a kind of professional support to those who need it. It doesn't live with the mindset that it will meet a dilapidated health infrastructure that it has to suffer while providing that professional support. And really, the solution is not to educate health professionals and tell them, oh, don't worry, you have already made an oath, so you need to wait while you're suffering. It's not going to happen. I mean, if you have a child and you paid so much for that child's academic, especially medicine, that is, it's for those who actually really did well in JAM to be able to earn that opportunity to read medicine. Would you curtail them from advancing their careers in the international space because as a continent or as a nation, we're not living up to our own responsibilities of providing the right infrastructure for them to work with? That can't be the case. I mean, I will never be a supporter of that. It's the country itself that needs to look inward. If you want to retain good talent, then you have to earn it. You have to encourage them. You have to motivate them. You can't stop them from going to better advanced or where they even perceive is better. So I hear your point that going abroad might not. Yes, but I'd rather want to go and test it, is my answer. I'd rather want to go and see for myself. Let me go first and fail, and then maybe I would think of coming back to village to come and render healthcare. So really, in actual fact, the advocacy should be to the primary responsible parties, largely, so that they can live up to their responsibility. And also maybe, as much as possible, make health a multi-stakeholder affair, as against just zeroing on health professionals. And everyone should be involved in the health and healthcare of Africa as a continent. Over.
Thank you very much, Dr. Morris, for that reply. It was very comprehensive, and I'm quite sure that Coach Richard's question has been answered. And just to add to it, one thing I know definitely is that when we talk about advocacy, right about today, everybody has a platform to one. There are about more than 5 different social media platforms that, when you continue based on individual interest to speak for a particular thing, you will attract the right audience, which may help in amplifying what you're advocating for. And maybe through that, if it is something that you feel you need a movement for, the social media space allows you to be able to meet this kind of people, and before you know it, it's all over, and it's making the impact you want to make. I remember we've had quite a number of advocacies that have just been that got started right on the internet, on the social media, and they ended up, coming into national bills and all of that. So I think that's just what I will have to. Dr. Maurice, thank you very much. It has really been a great time with you. We enjoyed every bit of your presentation and insights. And, because of your time, I think I want to go over now to Dr. Olaide. So, on behalf of the leadership of ADF Africa, we want to say a special thanks to you for making this section this afternoon, and we appreciate your time for this presentation. Thank you very much, and we hope to be able to call on you some other time.
Thank you. Good afternoon.
Yes, and you do have a nice evening there. Yes. I see a whole lot of things going on the YouTube space. And of course, we are having a great time, that is for sure. But I think even right about now, it's just, getting started because it's going to be further interesting. Um, Dr. Olaide,
Right here.
oh, fantastic. Well done, Ma. Uh, we have some questions which definitely, you as our panelist, you're going to be helping us to answer this afternoon. We've had Dr. Morris' presentation help us set a tone for the discussion, exposing us to the status of the health system in Africa. We've quite understood now what the key challenges facing health systems in Africa are and how these challenges impact our development efforts. Now, I do not want us to leave this section this afternoon without having some action areas which, we instigate actions beyond this section. So I want to quickly ask now that, Dr. Morris mentioned that even the areas of core needs of health intervention, they are not the urban and the peri-urban centers upon which attentions are in recent time, but much more the rural environment which do not have any support system to these resources that we're talking about. So this wants me to ask that in what ways can investment in primary health care and preventive measures contribute to the resilience of health system, especially in rural areas in Africa?
Thank you very much. It's my pleasure to be here. I'd like to first say that, to be honest, the healthcare system in Africa is nowhere near what it should be. If I'm to be honest, I'll say we don't even have the system, because what people run to typically when people say they're going abroad is actually because there's a system, not necessarily that things are easier for them. So now we're talking about rural area. But you see, before you go rural, even people in the urban are going through a lot, So in the urban, we definitely have healthcare systems in quote, but are they really as functional as they should be? If we're saying that already about urban, then we have a big problem about rural. Rural, to start with, how many doctors want to go to the rural area? How many nurses want to live in the rural area? I heard the coach talking earlier, and what I picked from him was that even the nurses now are being coached to say, finish doing nursing and go abroad. So what am I emphasizing on? Medical personnel, healthcare personnel. We are just not ready to go to the rural area in any way. And then when we talk about the little bit of healthcare we send to the rural area, is when we do things like outreaches. We have outreaches where we just go there, maybe some churches, some organizations, they go there once in a while. And that's like the best they get. I've been involved in a few, and what happens to the people there is that when you go there, even the headache they don't have, they will tell you they have it, just because they want to be able to collect something small. So what am I saying in essence? It's a total overhaul that we need in this healthcare system in Africa. to narrow it down to Nigeria. Apart from the fact that the medications, the equipment, and all of those are not available, manpower is also a major. So it's a real big deal that I think this event that we have today I believe, is a step in the right direction to help us solve it. But typically, there must be a system. Once the system is in place, it will percolate both rural and urban, and it will not separate the fact that you're here or you're there. Because even in this Lagos, there's some places we know is Lagos, but we know it's more rural than village. They don't even have access. Even transportation is a problem. So in essence, I want us to still look at it globally and check how we can have that system that works for humanity, regardless of your location.
Thank you very much, Doctor. Thank you very much. Something surprises me, and I start to wonder how we find ourselves in these states that we have when we talk about the health sector in Africa these days. I continue to reminisce and look back in time into the cases of, those health crises that we've had in Africa in the past. The cases of Ebola outbreak, so many other, the bubonic plague, and so many other health crises that we've had. So when I look at how things are and the state that we are right about today, it continues to baffle me to ask that have we not had any lesson to learn from this past health crisis? And if then that we've seen the level of damages, casualty, and havoc that this past health crisis has wreaked upon Africa, this part upon which we are treading today, lack of manpower, people are not willing to go into the rural area. Our health sectors, hospitals, primary health centers, they are ill-equipped with facilities. Are we then not calling on further health crises that would now even hit Africa harder than we've ever been hit?
That's a big one. So thankfully, we're religious people, and thankfully we're delivered from Ebola and COVID, not because we were ready and not because we had what it took to be ready or to take care of such pandemics or epidemics, you see? But you see, we need to now pick what lessons we learned from those crises. First is readiness, right? How ready are we if another one strikes? Readiness starts with healthcare practitioners, the people that need to give the healthcare that we need. Now I want to talk a little bit about, for me, I believe that we also need to go back to the schools, all the healthcare schools, whether medical or nursing or lab or pharmacy. Firstly, I don't know why we're competing. There's a huge competition amongst these healthcare practitioners. When we put the competition aside, there's also a reason for why are you into this profession. A lot of people don't know why they became what they became, either doctors or nurses or anything, because a lot of them feel it's the money that is there for them. So we first need to go back to the roots of how we're actually bringing up and training the people we have. Once that training can be gotten right, honestly, no enticement abroad will make us go away. So now we're talking about how to have personnel in place. Now we have them in place. We learn a lot of things from the pandemic as well. Typically, we learn also that online consultations is no longer a taboo. Before that, we're struggling to say, oh, you can talk to your doctor online. And the older doctors, the more traditional ways of seeing patients kept on saying, no, you must also still touch your patient, you must see your patient, you must, COVID taught us that you can actually treat a patient through your internet. So we know that technology now works for medicine. So we need to be more technologically equipped. Thank God we're not saying we don't have internet in Nigeria. Thank God we have that. That is working for us. Okay. Then of course, healthcare starts from you and from me. So we need to do more health educating. There must be a lot of education to people, because when diseases start, it is the person who has it that will feel what he or she is going through. But if they assume it's not a problem, then they don't even get up and seek help. Because I tell people, even the days of COVID, we all probably had symptoms, of the COVID. Some didn't recognize it, some did, some sought help, some didn't seek help and they died. So healthcare itself starts from you and I. And then accessibility to where you can now get help, is now maybe what government should look into. But for what we took out from COVID, it's also teaching us that you are in charge of your health. Now people know how to wash hands, unlike before, when everybody goes about shaking hands and picking food and maybe getting gastroenteritis and all of that. But generally, the government is what we need to hold. When we talk government, everybody says what's government. Because private sector too will be involved, yes. But then we need, when COVID and Ebola came, it wasn't a personal thing. It was a government thing. Everybody's hands were involved. So public-private participation is also very, very important in all of this.
Thank you very much, Doctor. I love the fact that you were able to touch into the aspect of technology, for our health sector reform in Nigeria. And yes, we've seen that example with a lot of adoption of artificial intelligence as well as high tech in recent time. However, it still continues to be a little problem because it appears as though this kind of interventions are directed into the urban space. Because you can imagine now that for the rural areas who do not even have power grid, they don't even have access to energy. They do not have. Okay, these are some areas wherein once it rains, the telecommunication is not working again. They are given so many. So you can understand that there are still that feels as though there are still some limitations to the aspect of technology adoption in Africa right about today. So I remember that while I was having a discussion with someone before this section, that person pointed me to an aspect which I realized that it was actually true. That person said that almost everything that is being dispersed in Africa today may not reach the deadliest parts of Africa. But when it comes to sharing utility bills or any immunization, it gets across each and every household. So I now start to wonder. So I was talking to the person, and the person made me understand that. Do I realize that in during the COVID time, all about almost everywhere, heard, not only heard, had the consciousness to practice hand washing and the use of sanitizers. And I realized that at that time, because there was, the policy in place that for each and every person that is not wearing the nose mask, they should be arrested and should not be allowed access to some public spaces like the banking halls, eateries, and all of those things. It appears as though people took the hat intentionally. So this is not even making me to look at it that, I realize that it seems that government policies, especially when carefully implemented and followed with keen actions, seems to always work for us in Africa. So I was now going to ask that what do you think could be key policy priorities and reforms that would need in Nigeria so that just maybe when we have some senior health personnel listen to this section or join us on this section, they can hear these are some of the recommendations that we have from this roundtable discussion. So I want you to recommend to us now what policy priorities or reforms do you think could strengthen the health system's resilience in Africa, and much more, how can they be effectively implemented?
Thank you very much. I like the fact that you made it clear that urban-rural division didn't come up during those times. And in the same way, when you look at developed countries, there's nothing like urban or rural. Everything gets to wherever. Postmaster gets everywhere abroad. So I didn't want us to focus too much on location, because if everything is on ground, location is not an issue. So now what are the recommendations so that we can have cross-border healthcare throughout Africa, no matter our location? We start with the human capital. We need to have well-trained human capital that do not discriminate by location. The people that are jackpying, they jackpot to a village, they're working there, and they're comfortable. So one makes it comfortable because they have everything it takes, whether they're in rural or urban locations. They have the comfort of living there. They have the amenities you mentioned. There's electricity, there's water. They're comfortable in the real sense of it. So those are the things we expect government to do for us as a people. We are generating power by ourselves now in Nigeria as individuals. Power is the measure to live well. When you ask people that go to those other countries, developed countries, they say there is power. They're not even talking about money. There's 24-hour power. So we need power. We're even talking about immunizing people so that we can break the backbone of immunizable diseases, which we're doing to a large extent. But we also need power to keep those vaccines potent. So we need power. And then, of course, advocacy, we're doing a lot of that. But I see that even advocacy, what is the motive behind advocacy? Why are we asking people to take vaccines and then we're now giving them incentives? If they understood our advocacy so well, they will present themselves for that vaccine without you having to tip them, because I call it tipping. So we just need to go back to the board and do a lot more work so that we know that we are doctors, we're healthcare professionals who have the heart of people. We're interested in seeing health work. We're not interested in the name, the fame, the money. That is not what we're interested in. I typically always say that you need to put a divider between doctors who just want to be academicians and doctors who truly want to make impact in the lives of people. So we need to do a lot of that also. Then, of course, accessibility to all of these things. If we say go to a doctor, go to a GP, there should be access. Access in the sense that you can even take a walk to a GP or to a private health, PHC, local government hospitals or something. But it's not just to go there. What are you going there for? Are you sure you'll be well taken care of? Is everything available? But importantly, accessibility. I don't have to travel so far. Somebody has headache in Aja and has to get to Ikeja before he can get help. Anything can happen on the way. Accessibility, affordability. Affordability, thank God Lagos State is doing something now. It's saying pregnant women can go for free antenatals. I think children too are getting, those little things really count in making sure these things work. And of course, collaboration between government and private sectors. Like she said, like Dr. Atoki said, it's not just private hospitals or private practitioners, but we're talking about people who have heart for health. They can also collaborate because government can't do everything. Earlier when I said government, first of all, who is government? What is government? So we need to come together and know this is a problem we all have or can have. Nobody is immune to having health issues. If we look at it from that angle, it can be anybody's brother, sister, whatever. So what am I saying? We need to have a heart. to be able to help and say we want to all put hands on deck, especially when there are preventable diseases. So many diseases are preventable. All people need is probably just health education. When they understand it, then it makes life easier. They're able to do the little things they should do. We talked about washing of hands. Now, we should talk about drinking clean water. Little things that actually add up to giving us good health. Mosquito net, to keep us away from malaria. Just those things. Let's go out there and do it with a heart.
Thank you very much. Thank you very much. I see the passion which you speak this afternoon, and I just wish that many of personnel within the health sector would have the same passion. It's a different thing these days when we talk about the status of the infrastructures themselves. It is another thing when we talk about the personnel within the infrastructures themselves. We've seen some videos in the past of negligence of the personnel leading to loss of life and so many other things ongoing within that sector. And these are the things that continues to instill fear inside people. They no longer have some confidence because of the way things are. Not even talk of now that you believe that when you approach a government facility for standard health care these days, you are not certain of what you are going to be getting there. So upon this, I now want to quickly ask you, Ma, that what would you think is the kind of the health sector that you want to see in Africa? What is even your picture for healthcare in Africa? So maybe, diverse persons that we have on this call this afternoon across different countries, they will have some level of exposition and they will have a foresight to what they can easily push for and even advocate for within the different countries that we have in Africa.
Thank you very much. You see, yes, I have a great passion for what I do and for this profession. Because we all claim to go abroad for treatment and all of that, but I can tell you for free, they're not as good as we are. But because we do not know better, so we all rush there, and then it happens. I've lost people abroad with the so-called good system, and they still died. So what do we need here? For me and for mostly what is going on in Africa as a whole, I think we have more of issue with one-on-one relationship with one another. We call it attitudinal change. When we start with attitudinal change, a lot of things will fall in place. When we know that I'm my brother's keeper, for instance, anybody having an accident on the road now, if it's bad, because you consider himself or herself dead, there's no ambulance you can call that will pick the person. There's no emergency, all those things are not in place. So it's a total overhaul. We all need to go back to the table and plan. How do we have healthcare at every locality? I don't need to travel far to get my healthcare. And we need to have grades. We talk about the first spot for quick things that happen around the home or the office, where you can quickly go and be taken care of. And not every health facility should be a hospital. I'll explain. Hospitals are where you admit. Not everyone should be huge and big, which is what every doctor aspires to have. And by the time it's huge and big, you're not able to actually take good care of the people that come to you, of your patients. I'm advocating little health centers that are of walking distances from people, so that the quick emergencies, things that happen, can easily be sorted. If it's bigger, then they can now be referred to bigger facilities, But by and large, as practitioners, we need to come together and work together. We're for one common goal. I tell my colleagues that we are all working towards making sure this patient is okay. We're not after who did it or who gave the idea. So there must be collaboration between healthcare practitioners. The nurses are quarreling with the doctors, pharmacists are quarreling with the doctors are quarreling with, attitudinal change for me is very key. Because once humanity comes into our hearts, then a lot of things will fall in place. Even when we put the system down and there's no humanity, it just might not work. That's my take.
Thank you very much, Doctor. You see, I feel like if we continue to go on this evening, there will be something to talk about, and we just continue to go on. Really, I wish that we can continue this discussion, but of course, I understand that there are other engagements to attend to. But before we go off from here, I can already see that some persons attest to the discussion direction in the chat. So I just want to give a chance to one of the participants that may have a contribution to make to this section, or maybe ask a question to ask. Before then, we'll call it an evening here. So, is there anybody on the call that wants to make a contribution, or has something to say to the discussion that we're having here? Such can signify by the raise of hand, and will allow you to speak.
I think Coach Idemu there wrote something here.
Okay, let me check.
I totally agree with you, Doc, but in a country where the mentality of ownership of responsibility is poor, and this is worsened by the fact that there's a general sense of political, social, economic, religious insecurity. Many people are scared of committing their resources to a nation they can't call their own. This critically affects both private community and yes, this is a fact, right? The fact that we are going through doesn't mean we'll throw our country away, and we will not. If we do nothing, then nothing happens. So I'll tell you a personal story. At some point, I got really disappointed in the healthcare in Nigeria. I see some malfunctions and all of that. And I decided to go home, that I'm not going to practice. I'll go and do trading, buying and selling or something. And this young lady, a pharmacist, said to me that the little quota you are giving to the society, you have taken it away. So that's, no matter how little it is, you've taken it out. So how do you make an impact? That was all she said. And I went back and I set up my own practice. So what am I saying? Because things are bad everywhere, so we add to the bad. Why don't you contribute yours? You never know how it's going to go. And anybody who has focus of money, making money in healthcare as the focus, then the person is not ready to make an impact health-wise. Health definitely is wealth, right? And to be honest, if everything is well done and harnessed, if you are taught how to prevent yourself from even falling ill, you're in a better place, than looking for how to get well. And then there's a problem between public and private practitioners. They are loggerheads. I don't know why. As long as your focus is patient, your patient's well-being, and your patient now becomes someone to you, not just a file, not just a number, then we are just putting foot in the right direction in what we should do. When you get a call from your doctor, you feel good, but here you don't even remember who the patient, you don't even care. Even patients calling you are like, oh, who is this? All those things matter a lot. Something I learned many years ago, they said, why do you choose this particular healthcare service or this particular practitioner? And guess what the answer is? The way they made you feel. Because if you go to a hospital and you go to treat malaria, you're certainly getting the same medication regardless of the hospital on the face of the earth. It's the same medicine they're going to give to you. But why do I go back there on another day? It's the way I felt. It's the way they made me feel. It's how happy I was being there. But when a woman is giving birth and the nurses are saying, oh, look at her. Now she's giving, will you push and let us? You definitely will not want to go back there. So in essence, all I'm saying to us, not only for healthcare, remember that the totality of what we're talking about is not just health, it's also wealth, right? It's social well-being, it's everything. Because remember, the definition of WHO's definition of health involves everything. It's not just not being sick, it's a state of total well-being and not merely the absence of disease. Remember, there's mental health, there's spiritual health, it's a sum total. So by the time we all are keeping our wealth in quotes, or our resources, or our skills, just because we feel Nigeria is not fit for us to give it to, then we're not ready to move.
Thank you very much, Doctor. I'm sure that everyone on this call right now, we are living here this evening charged. We are living here different to how we joined this session today. And I'm so happy, I must say that, this discussion this afternoon was able to touch the different areas that we were able to touch on. Thank you very much, Dr. Omotosho Ikuru. And we appreciate the good work you're doing with Earth Skynet. And of course, we appreciate that you have made time out of your busy schedule to be on this section with us this evening. And even beyond that, even with the, little errors in here and there before we were able to come on this section, it didn't even appear as though there has been a glitch at all. Thank you very much. We really appreciate you for everything you do. So on behalf of the leadership of ADF Africa, we appreciate you kindly for your time this afternoon, for your wealth of experience that you have shared with our audience. We are definite that this session this afternoon is going to make a whole lot of impact, not just on the ADF family, but even on each and every of the Africans that would be opportune to listen and maybe rewatch this section, because this is live streamed on YouTube, and I can assure you that more and more persons would definitely have a watch on it. And if you also would be needing it for your audience too, we'll be glad to share with you so that much and more persons will be able to benefit from this very rich discussion that we've had. So thank you very much this evening. This is the time that I want to allow you to go, Doctor. And we are closing the section this evening until next month, when we'll be looking at another goal. And of course, one thing is started, we have diverse programs across board at ADF Africa. I'm sure that one of these days again, before the end of the year, we'll have to call on you again, Doctor, to have an heartfelt discussion as this again with you before the end of the year. And I hope that whenever we call again, we'll find a place with you, to be able for you to be able to accommodate our invitation once again, ma.
The pleasure was all mine. Thank you very much.
Yes, thank you very much. And to every other person that is able to make this section this afternoon, I really feel to know how you are feeling now. But of course, in the next 1-2 minutes, you can do that in the chat. Let me know what you have felt here this afternoon. Do that with your emoji. I am definitely fire that is going to take over the whole place. Of course, this is what we are talking about. We won't sit back and allow things go on the way it's going. We are the change agents that the world need around now. We are the change that Africa is looking forward to. And in the little way, if there is a little thing that you can do this evening as a contributor to this change, go on to the YouTube, copy the link for this session, and share with your audience. You'll be marveled at who and how many persons will benefit from this. So thank you very much, everyone, and we hope to see you again next month. And we are sure that definitely we are going to have a great and very impactful week as we onward go. Have a wonderful evening, have a good morning, have a good afternoon, and see you again, everyone. Bye for now. You can unmute your mic if you wish that I hear your voice before you go.